हेलो एंड नमस्कार सभी को। मैं हूं दिव्या, आपकी होस्ट, एंड वेलकम टू टुडेस लाइव सेशन। Warm greetings everyone. I'm Divya and I'm excited to connect with you all in the session. Today we are going to discuss hypersomnia, symptoms and treatments for it. Let's get started. So we have our expert Dr. Anup Katyal for today's session. So he's an ICU critical expert, board certified in internal medicine, critical care, neurocritical care, and sleep medicine. He has experience of over 30 years. So, Dr. Anup Katyal, it's really nice to meet you virtually.
Thank you for having me. Nice to meet you too.
Yeah. So, without further ado, should we start this session?
Sure.
Yeah. So for today's session, my first question is like, what is hypersomnia?
So in lay terms, hypersomnia is excessive sleepiness. And as far as our sleep medicine field is concerned, we ask people to fill out a simple questionnaire, which is 8 different questions, which you can rate from 0 to 3, and you add up. So the maximum you can get is 24. So it is called Epworth Sleepiness Scale. And if it is greater than 10, we say, someone is excessively sleepy.
Okay, so you told about hypersomnia. So like what causes this hypersomnia?
So that's an important question because depending upon what the cause could be from sleep standpoint, whenever I see someone, who presents with excessive daytime sleepiness, we look at several possibilities. Number one is insufficient sleep. That's very common. If you don't sleep long enough, then obviously you would be tired and sleepy during the daytime. Another thing we think about is sleep apnea, both obstructive as well as central sleep apnea. The third thing we look at is something called restless legs or limb syndrome. And accompanying that is something called periodic limb movements. Those are movements that occur at night when you're asleep. And restless legs occurs mainly in the evenings. Another thing we think about is narcolepsy. And we always have to consider mood disorder, which includes depression. Medications have to be ruled out because in this day and age, people are on a host of medications which can cause one to be tired and sleepy. And if nothing fits in the above categories and you're excessively sleepy after an exhaustive, workup, then we say you have idiopathic hypersomnia. In other words, we don't know the cause, but you are sleepy during the daytime.
Okay, so you mentioned about the narcolepsy. So what is it?
So narcolepsy is a condition which is seen equally in males and females, and it occurs usually in the teen years and when you're around like 20, and then there's a second spike when you're around 40. So this is a condition where you are excessively sleepy. And when we think about this, there are a few things we ask a patient. One is a condition called cataplexy. This is a condition where with extremes of emotions, either one is very happy when someone listens to a joke, or when one is sad, one has a feeling of your muscles giving way. You don't lose consciousness, and this may last for seconds. And so that's an important feature, which is called cataplexy. Another thing is as you're falling asleep or when you're waking up, you may hear or see things that are not there. So in medical terms, we call it as hypnagogic and hypnopompic hallucinations. And usually you have visual hallucinations that people see things that are not there as they're falling asleep. And last but not the least, we ask about a condition called sleep paralysis, which is a condition where you wake up in the middle of the night and you want to move, but you cannot move because you feel paralyzed. So when we think of narcolepsy, there are two kinds. One is called narcolepsy type 1, which usually is accompanied with cataplexy, and narcolepsy type 2, where you have excessive sleepiness, but you may not have cataplexy. So this is what narcolepsy is.
Thank you so much, Dr. Anup Katyal. You explained the details very well in great depth. So moving to our next question, like you explained hypersomnia, what causes it. So what are the signs and symptoms of it?
So as I said, as we go into all the causes of hypersomnia, as I said, insufficient sleep. Obviously, if that occurs, then you're tired, sleepy, lack of attention. You may face that when you see those patients. When I mention sleep apnea, then we ask about, do you snore? And there's a simple thing we look for, and I'm talking basically about obstructive sleep apnea. But that I mean stop bang. S stands for snoring, T stands for feeling tired, O stands for has anyone observed you stop breathing at night? P stands for high blood pressure. B stands for your BMI. A stands for age. As you grow older, the risk of obstructive sleep apnea increases. N stands for neck size. And usually a neck size of 15 inches in a female and 17 inches in a male is a risk factor for obstructive sleep apnea. And G stands for gender. Till a woman reaches menopause, obstructive sleep apnea is seen more in males than in females. And once after menopause, it is equally seen. Then when we talk of restless legs or restless limb syndrome, we ask simple questions. Do you have an abnormal feeling in your extremities? It can happen in your legs or in your arms. It happens in the evenings. It happens when you're resting. If you get up and walk, you feel better. If you answer yes to these four questions, that there is no other alternate explanation, we say someone has restless legs or restless limb syndrome. 80% of the patients who have restless legs, when we do a sleep study, we find leg movements at night when we do the formal inpatient sleep study or polysomnogram. And in those patients, we label them as having periodic limb movements. I discussed about, the features of narcolepsy. Then obviously, depression, we get the history from the patients. And usually, if someone has anxiety, usually they have trouble falling asleep. And if they have depression, usually they wake up early in the morning and have trouble going back to sleep. And otherwise, there are other symptoms also, which may suggest that someone has depression. We definitely have to look at the medication list. And again, as I said, if nothing else falls in those categories, then we think of idiopathic hypersomnia. Some of the hallmarks of narcolepsy, for example, the question you asked me before was, people don't sleep too well. And during the daytime, they fall asleep driving, they fall asleep talking. And if you ask them whether they take naps, they say they take short naps, like 10 minutes, and they are refreshing. And that distinguishes narcolepsy from idiopathic hypersomnia, where you tend to take much longer naps, which are not refreshing.
Thank you so much, sir. You explained like what are the signs and symptoms of hypersomnia. So my next question is hypersomnia is a brain disorder?
So as I said, hypersomnia depends on the cause. If it's insufficient sleep, it is more a reflection of the kind of world we live in, where one is rushing every day and there are only 24 hours in a day, and you're not spending enough time sleeping. When we talk of sleep apnea, that has more to do with one's weight. Having said that, 70% of the people who have obstructive sleep apnea are overweight and 30% can have normal weight. So that has to do with the anatomy, how your face is structured and so forth. As I said, restless leg syndrome or limb syndrome is associated with low levels of iron and deficiency of dopamine. So there may be some relationship there to dopamine production. When I mentioned narcolepsy, its etiology can be either, it can be a genetic predisposition, it can be an autoimmune phenomena, but there are patients who have what we call a secondary narcolepsy. Those are people, who've had any brain injury or small tumors, because there is something called a wake producing protein that your brain produces called hypocretin or orexin. And people who are narcoleptic type 1 are deficient in this. So obviously, if there is something in the brain that is pressing on the area of the brain that produces orexin or hypocretin, you can have narcolepsy. So in that situation, you can say it is a sort of a brain disorder. Idiopathic hypersomnia, we don't know what the exact cause is. And depression obviously has to do with chemicals that are produced in the brain. So depending upon what the etiology is, you may say that it has some link to the brain, but you cannot say as a whole that everyone who has hypersomnia has a brain disorder.
So thank you, doctor. for sharing your knowledge about the hypersomnia and is it a brain disorder or not. So before moving further, let me tell you to all the viewers that eGlobal Doctors is providing diet consultation. We have a variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health. So our approach is totally scientific along with some holistic transformation. So register with us today at eglobalDoctors.com and book your appointment to get the proper nutrition coaching. So let's back to our topic. So Dr. Anup Katyal, as you mentioned about the depression, so is hypersomnia is a part of depression?
Certainly, people who have severe depression can have hypersomnia. In other words, you ask them the history, they say they go to bed at 10, 11 and don't wake up till 11, 12 the next day. So they're spending like 10, 12 hours in bed, and during the daytime also they feel sleepy. So it could be a feature of depression.
Okay, so it like hypersomnia can be a part of depression. Okay.
Exactly.
So what are the disadvantages of it for a person who have hypersomnia?
Again, as I said, you asked what are the disadvantages. If someone has hypersomnia, obviously one is not productive during the day, one is tired, sleepy, risk of, accidents and so forth. And if you don't feel good during the daytime, it has a bearing on your functioning. So certainly it is very disadvantageous to have hypersomnia. And again, as I said, we have to shift through the history and then figure out what the underlying cause is and try to address that.
Thank you for that. Thank you for sharing your knowledge, Dr. Anup Katyal. So before hopping to our next question, viewers, eGlobal Doctors is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So viewers, we are live on FB, Instagram, YouTube, LinkedIn, Twitter. So you can join from your favorite platform and let us know your doubts in the comment section. So moving back to our topic. So Dr. Anup Katyal, we discussed about the hypersomnia, causes, their signs and symptoms, and like, is it a brain disorder or depression? So what age does hypersomnia starts?
So again, as I said, depends on what the cause is. When you see insufficient sleep, it's usually what you see a lot in teen years, but it can happen in any, even when you're adults, based on your professional life. Sometimes one is working 1, 2, 3 jobs, and if you're working multiple shifts, you don't have enough time you spend in bed. So that would be the insufficient sleep. As I mentioned, narcolepsy can happen usually in the teen years and around age 20. And then there's a second spurt you see around 40. Again, restless leg syndrome, if it is a family history, it can start off very early. But again, as I said, you have to think of iron deficiency anemia when someone presents with restless legs. So that can happen in any age. As I said, idiopathic hypersomnia, again, there is no certain age about that. Depression, obviously, we are seeing more and more in teen years. There is a very big warning here from the Surgeon General in the United States that, overexposure to iPhone, electronic media, social media is causing teenagers to have, significant anxiety and depression. So that is playing a role. And definitely medications, more and more we are seeing teenagers with, certain medications which work on the brain. And unfortunately, there are side effects of a lot of these medications, whether they are benzodiazepines, whether they are muscle relaxants, whether there are certain other medications that work on the receptors in the brain. Unfortunately, they have a side effect of making one tired or sleepy. So it depends on the scenario.
Thank you so much, doctor. So viewers, if you have any signs and symptoms of it, there is no need to worry because we are here to help you at the comfort of your home. And you can reach out to experts like Dr. Anup Katyal on eGlobal Doctors if you need any help regarding hypersomnia or sleep problems. So moving to our next question, Dr. Anup. So how to treat this hypersomnia?
So again, as I said, as one gets a good history and gets an exam, I'll quickly go down each If there's insufficient sleep, we say normally an individual needs 7 to 9 hours of sleep. Obviously, when you're newborn, you'll sleep much longer, but starting from the teen years onwards. And so a good way of figuring out how much sleep an individual needs is, if one is working, figure out how much sleep you're getting on the weekdays, and then how much sleep you're getting on weekends. And so on weekdays, when you're working, if you're getting, say, 6 hours of sleep, and on weekends, when you're not working, you're sleeping 10 hours, then your sleep requirement is somewhere around 8 hours. So no two individuals are alike, but the amount of sleep that makes you functional is what is needed. So that's with insufficient sleep. Second most important reason, as I said, was obstructive sleep apnea that we see. And if you have sleep apnea, it is treated with either we recommend weight loss, which would not be a treatment, but would help you. But we try this machine called CPAP, which stands for continuous positive airway pressure. That's the most effective treatment for obstructive sleep apnea. Another treatment option is an oral appliance that basically you wear at night, which forces your lower jaw forward. There's a surgical option, which is usually not effective. Sometimes we ask patients to wear a device, which is a one-way valve. When you breathe in, air moves in. When you breathe out, it prevents air from coming out, creates back pressure to keep the airway open. And last but not the least, you must have watched on television, there's a device called Inspire. It's like a pacemaker that goes in your chest. With one lead goes to your muscles and one to the nerve. You turn it on at night, and whenever you take a breath in, it forces your tongue out. So that's how it works. So this is obstructive sleep apnea, where essentially you're closing your airway shut at night when you're asleep, which is then causing different kinds of problems down the line. So obstructive sleep apnea is linked to high blood pressure, stroke, heart attacks, irregular heartbeat, blood clots, and high blood sugars. Those are the associations of untreated obstructive sleep apnea. So it's not just the snoring part, but the accompanying things that occur when you have obstructive sleep apnea. I should point out that everyone who snores does not have sleep apnea, but everyone who has sleep apnea snores. So you have to have the proper evaluation to tease things out. If you have narcolepsy, you can have narcolepsy with cataplexy. Again, as I mentioned, there are certain medications like sodium oxybate, which work both for sleepiness as well as cataplexy. Otherwise, there are other stimulants like modafinil, other stimulants like armodafinil, which are wake promoting drugs. And then for cataplexy, you can use certain medications called SNRIs. If you have idiopathic hypersomnia, again, they are diagnosed by means of a good history, an overnight sleep study, and then we have you take naps during the daytime. And during the naps, if we find that you're falling asleep like within 8 minutes, then that's pathologic. And if you go into a certain stage of sleep as you fall asleep, that's how you diagnose narcolepsy. So if you have idiopathic hypersomnia, there are certain medications, again, like sodium oxybate, a variant of which is approved by FDA for treatment of idiopathic hypersomnia. Obviously, if we see someone has restless leg syndrome or periodic limb movements, then there are medications like gabapentin, Lyrica, dopamine agonists, benzodiazepines, and as a last resort, pain medications that can be used. And obviously, if someone has depression, then there are a host of antidepressants that can be used. And I should also mention that we have to have a very good look at the medication list and obviously weigh the pros and cons of the medicines one is taking. And if the side effects outweigh the benefits, then that should be also looked into as far as treatment of hypersomnia is concerned.
Thank you, sir, for providing lots of information about the topic and how to treat hypersomnia. So going forward, so I wanted to ask, like, what is the difference between fatigue and hypersomnia?
So in our sleep world, people use fatigue and hypersomnia basically interchangeably. So someone says fatigue, it may imply that they're tired and sleepy. But in general, when we say someone is fatigued, it generally means that there is lack of either physical or mental energy, and that's what fatigue is. Whereas sleepiness is obviously, you're dozing off in places where you're not supposed to, whether you're driving, whether you're having a conversation, and so forth.
Okay, so that's great to know. So my last question is, Dr. Anup Katyal, can hypersomnia causes weight gain?
Definitely, again, we see it a lot. Again, as I said, we see obstructive sleep apnea, for example, one of the very common causes for excessive daytime tiredness or sleepiness or hypersomnia. And if one has obstructive sleep apnea, during the daytime, you don't function well, you don't exercise. When you're not doing much, you tend to overeat. So there's a cycle that goes around. So definitely, certain situations where you have hypersomnia, for example, obstructive sleep apnea, could be one reason why you would gain weight.
Okay. So I think our audience has got lots of useful information about the hypersomnia and its symptoms and treatments. So, Dr. Anup Katyal, can you provide a summary for the topic to those audience who just has joined us?
So hypersomnia is, we don't give much importance to sleep. And if you look at it in your lifespan, you spend a third of your time sleeping. So what goes on when you're sleeping carries, a lot of weight. So the most important thing is, you should spend enough time in bed. So that is when you don't spend enough time or cannot, we say you have insufficient sleep. Insomnia is totally different topic where, you're going to bed at 10, waking up at 8 and getting 4-6 hours of sleep. But that's a state of 24/7 hyperarousal in its real form. But the topic today is hypersomnia. So insufficient sleep is a very important cause. And if you feel tired and sleepy, just don't straight away go that you're depressed. In the appropriate setting, as I said, there's a simple stop bank questionnaire that can be done very quickly. And for example, you don't do the whole, just the stop part. If 2 out of 4 is present, then that's a risk factor for sleep apnea. You should see a sleep doctor, and you should, sleep apnea is diagnosed by means of a sleep study. And currently we can do home sleep studies as well as in-patient sleep studies. Then in the appropriate setting, depending upon the age and depending upon presentation, narcolepsy needs to be excluded. As I mentioned, depression is an important factor. Medication needs to be looked into. And if you have exhausted everything, and obviously we get a good history, a sleep diary, sometimes actigraphy, and this day and age with cell phones, people can look at, their sleep and how much sleep they are getting. They may not be the most accurate, but you get a good idea about your sleep. And if nothing, fits, then we say you're sleepy, we don't know the cause. And this is what we label as idiopathic hypersomnia.
So thank you, Dr. Anup Katyal, for providing the summary to those audience who just has joined us. Viewers, although you might have these signs and symptoms of hypersomnia, so no need to worry, as our expert at eGlobal Doctors are here to help you. So visit the website eglobalDoctors.com or download our application now. So before wrapping up the session, viewers, we are delighted to announce eGlobal Pharmacy services for our customers with an exclusive 15% discount. And yes, you read that right. This exclusive promotion is made possible through our esteemed partners, Apollo Pharmacy in India and V Pharmacy in the USA. So together, we strive to provide you with the highest quality medications at affordable prices. So visit now eglobalDoctors.com. So thank you so much, Dr. Anup Katyal. It's always a pleasure to have you in our live sessions. You always bring so much of information. Thank you for that.
Thank you so much for having me.
Yeah. So before wrapping up the session, viewers, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. So any words for our viewers, Dr. Anup Katyal?
I would just say, as I said, regarding sleep, that, one has to pay a lot of importance. We try to go for quick fixes, but sleep is very important, and it's just like your battery. If you're charged, you will function well. If not, then it will have significant ramifications during the daytime.
Yeah. So thank you, doctor. Thank you, audience. So it's a wrap.
Thank you so much.
Thank you so much, sir. Sorry.